Hi everyone, this is Dr. Santosh talking about the purine and pyrimidine bases, and we'll talk about all the significances of this bases that you really need to know for exams. So here, just see, you know that this is pyrimidine, and pyrimidine has one ring and purine has two. And you know the purine and pyrimidine, they are heterocyclic compounds. They have nitrogen and carbon. They're made with the nitrogen. The ring is made of nitrogen and carbon here. So now for pyrimidine, you can say let's focus on the contribution of folate here. So for pyrimidine, the ring structure is not contributed by folate. Mark this point: ring structure is not contributed by folate. Only thymine gets contribution of folate as methyl side chain. That's the only contribution of folate towards pyrimidine. Now let's talk about this purine synthesis. Yes, for purine, yes, the folate do contributes to the ring structure. Okay, folate do contribute to the one carbon of the ring structure. So always remember, folate metabolism means one carbon. It always contribute one carbon. Here you can see the carbon between nitrogen, the second carbon between nitrogen and two nitrogen. Here you can see the eighth carbon, that is between seventh and ninth nitrogen, is contributed by folate here, and other amino acid and carbon dioxide will form other part. So and this is the ring structure of this. So folate contribute to the purine ring, and folate contributes to the side chain of pyrimidine only for thymine. Now the what you really need to focus on the structure of this purine and pyrimidine is because purine and pyrimidine, they form hydrogen bond. So that is why you need to be really thinking about the side chain, which side chain is present there. First you need to know those purine is two ring structure, and you should be knowing about this ring structure is very important. So you should be knowing about this ring. One ring in purine is similar to pyrimidine. This is called pyrimidine ring. This on this pyrimidine, other ring is fused, that is called imidazole ring. So this two ring composite ring is called purine ring. Now purine ring, adenine. So it's easy to remember for adenine, side chain for adenine. You can find in adenine NH group is amino group is side chain. So no other side chain is present in adenine. So but when you see guanine, guanine has two sides. One is oxo, other is NH2. And cytosine also has. So that makes these side chains, two side chains plus the nitrogen in between, they make three hydrogen bonding with each other, guanine and cytosine. Thymine and uracil, you can find their oxo group here, two oxo group, similar structure because they are similar side chains, except thymine has one more methyl group. Thymine is a methylated uracil. So this side chain methyl group comes from what? Folate. It comes from folate. Now when you understand this side chain, there is one significance: it helps in forming hydrogen bond. Other significance is the side chains are relatively chemically very prone to oxidative damage. Okay, so and the amino group there, they can be deaminated. Amino group is replaced with the oxo group, so that can be cause for mutation. Okay, so oxidative damage or some alkylating agent will come and attack the nitrogen group in the ring, and that can be a cause of mutation. So these groups are prone to chemical reactions. So these are the point where mutation, because of changes in this basis, there can be mutation. This is mutation. This is the reason for mutation. Now you know mitochondrial DNA, they are not repaired frequently. So what happens in mitochondrial DNA? This side chains of this DNA, they are repeatedly damaged because of oxidative damage. So a repair mechanism is not that efficient. So in due course of time, what happens? Mitochondrial DNA will lose its effectivity for the synthesizing protein. So what happens ultimately? This mitochondria will be damaged or aging. The aged mitochondria will be little non-functional. So that is one of the theory that has been given for aging, the cause of aging. So this DNA, this nucleotide bases injury is the cause for aging. Now in pharmacology we'll study a couple of many drugs that are there in anti-cancer drugs. Those are anti-cancer drugs, immunosuppressant drugs, and some of the antiviral drugs. They are related somehow with the base synthesis or nucleotide synthesis. One of the very important thing you have to remember is you have to understand, you have to realize one very important concept, that these bases, they are being synthesized for DNA and RNA synthesis for dividing cell. Where dividing cell is present? Dividing cell is present in your bone marrow, your basal layer of skin, your intestine. So intestine is always mucous membranes are rejuvenated because of the basal layer, your hair follicles, those all cells are constantly dividing. And those dividing cell requires a lot of this purine and pyrimidine bases. Those purine and pyrimidine bases are being synthesized. Now, if you add some drugs that will inhibit the synthesis of those purine and pyrimidine, then there will not be any synthesis of those purine and pyrimidine. There will not be supply of DNA and RNA substrate, and then cell will not divide. So you can see this folate, if you somehow choke the supply of folate. So you know folate contributes purine and also pyrimidine is thymine. It contributes to the thymine. So if you choke the supply of this folate through by altering the, if you interfere with the metabolism of folate, then what will happen? There will not be supply of this substrate, and there will be interference with the DNA and RNA synthesis. So the other things, if you supply some molecule that looks very similar to nucleotide, so that looks very similar to purine bases or nucleotide, what will happen ultimately? They will also interfere with the DNA and RNA synthesis, and ultimately what will happen? Your DNA RNA synthesis does not happen. This is how we stop cell proliferation in anti-cancer drugs. So cancer cells will be affected more than normal cells, and we somehow can control cancer. And immunosuppression drug also, because for immune reactions the immune cells, T cells and B cells, needs to be proliferated. So we somehow suppress the proliferation of those cells, and that is how we can control through this type of drug that will control the synthesis of purine and pyrimidine. We can control immunity, we can suppress immunity. And virus required to multiply. So some antiviral drugs are based on this. They are very similar to this purine pyrimidine, or they will inhibit the synthesis of purine pyrimidine, especially in a virus. So this is the significance of purine and pyrimidine bases. If you understand really, that is why you really need to know this purine and pyrimidine base, which molecule contribute which part of this ring. You really need to understand really well, and then this side chains also has to be understood very well.